And now we're going to talk about Medicare and health insurance, a little more complicated subject. And again, as Howard said, all of this stuff's going to be on the website, so you don't have to take notes. Anyway, key is when you turn 65 and become eligible for Medicare, any health-related benefits that you get from Stellantis stop. Medical, dental, vision, hearing, drugs, everything just stops. So you're left with just Medicare. And again, if you're not on Social Security already, when you turn, about 3 months before you turn 65, just go online to ssa.gov, sign up for Medicare, which you definitely want to do, Parts A and B, or you can call the toll-free number. At the same time as you do that, you want options for supplemental coverage. That's Part D, which is prescription drugs, a supplemental plan called MEDICARE, or a Advantage plan sometimes called Part C. Then about 2 months before you turn 65, you'll want to make your decision about that supplemental coverage. And you want to do that 2 months ahead of time because this is the government you're working with, and they got to have time to process all the paperwork. So you want to, like I say, start early and make your decision a couple of months before your 65th birthday. Now, if you're already taking Social Security, you're about 4 months before your 65th birthday, you're going to get a postcard. And the postcard's going to say, do you want to turn down Parts A or B? For about 99% of us, the answer is no, don't do that. Just throw the postcard away. And then the rest of it's kind of the same. If you don't get the card 3 months before you're 65, call up and find out why you didn't get the card. And then again, explore all the options that we talked about before for supplemental insurance. And again, 2 months before your 65th, sign up for whichever supplemental plan you decided to take. Okay, how does Medicare actually work? There's several parts, A, B, C, and D, and Medigap. A and B are hospital and medical, and that comes directly from the federal government. C and D and Medigap come from private insurance companies that have to get approved by the government. And the other thing is that Medicare does not include drugs, dental, vision, or hearing coverage, although some of the Advantage plans do offer some of that. But Medicare itself does not include drugs, dental, vision, or hearing. Okay, basic. Part A, you get automatically when you turn 65. You don't have to pay anything. It covers primarily hospital inpatient care. There's a $1,716 deductible. It's estimated for 2006. It covers skilled nursing facilities. It includes hospice, which is really important, I think, and home health care, because there's a big effort to do like home hospice care, which is becoming quite a bit more popular. Part B has a monthly premium, which for 2006 is, we think, going to be $206.50. You have to pay that. Usually it comes out of your Social Security check automatically. And Part B covers 80% of services you get from doctors and other healthcare providers, outpatient, home health care, wheelchairs, walkers, other kind of durable equipment. And it also covers many preventive services, health screenings, mammograms, vaccines, and a wellness visit. So that's pretty good because they're encouraging you to try to do preventive. Okay, as we said, In Part B has a $288 deductible. And after you meet the deductible, again, it'll pay about 80% the charges from your doctor, and you have to pay the other 20%. And it includes most doctor services. And almost all will accept Medicare. There are a few who don't. It covers outpatient therapy. Again, it covers durable medical equipment. The one thing is, if you're fortunate enough to have a significant income after you retire, this includes investment income, such that your modified adjusted gross income is more than 106 if you're single, or 218 if you're filing joint, then that $206 premium you'd pay for Part B goes up. And if you have a Part D prescription drug plan, the premiums for that are going to go up also. The government figures that all out. They use your prior 2-year income tax return to figure out whether you're going to have this IRMAA, income-related monthly adjustment amount. And there's nothing you can do about it. It's not negotiable. It's just what happens if you're fortunate enough to have a lot of income of any type, not earned income, but it includes all your investments, your mandatory distributions from your IRA, anything like that. Okay. Then we have something that's called Advantage plans. You've probably heard about these. There's a lot of advertising by the insurance companies, sometimes called Part C, but usually called an Advantage plan. And the way that works is they say, okay, instead of you having to carry your Medicare card and a supplemental card, you just carry an Advantage plan card, and they're going to provide the A and B and usually the D prescription drug services that are normally covered by Medicare. And a lot of these Advantage plans try to offer you some extra benefits. They may throw in some dental, some hearing, some vision, sometimes extra cost, and sometimes they just throw it in. But you still have to pay that Medicare Part B premium, and then you pay whatever the Advantage plan monthly premiums are. Then we have Part D, which is prescription drug coverage. This has been improving significantly over the last several years. It covers the cost of prescription drugs. It's run by private insurance companies that have been approved by Medicare. And you can review this every year because your need for drugs may change or the price of drugs may change. And the nice thing about Part D, and there's going to be a really good presentation later on the details, you can change drug plans any year during the open enrollment period with no penalty if your needs change. Again, John's going to do his usual super job at giving you a lot more detail on that. Then we have Medigap, also called supplemental insurance. So this is if you take conventional Medicare, not an Advantage plan. You then get a Medigap plan that covers most of what Part A and B doesn't cover. Co-insurance, deductibles, and these plans are standardized by the government, and they're designated by letters, A, B, D, G, K, etc. The key thing to understand about this is, by law, all insurance companies that are offering you Medigap, if let's say they're offering you a Plan G, it doesn't matter what company you buy that Plan G from, your benefits will be exactly the same by law. So what that means is you have some chance to do some comparative shopping, shop different insurance companies, and see who gives you the best deal. There's going to be a lot more information about that shortly. There's one other thing that's very important. when you first become eligible for Medicare, that is when you turn 65, you will have what's called guaranteed issue. And what that means is that when you go to apply, let's say for a Medigap plan, it doesn't matter what your current health is. You could have some really nasty pre-existing conditions. Doesn't matter. When you first become eligible for Medicare, these companies have to accept you. After that 6-month period, that's no longer true. You can be subject to medical underwriting. Apologize a little for this eye chart, but these are available many places. The government has them. But these give you the big plans here, A, B, C. You can see Plan G is one of the more popular. You can see it covers almost everything. And the other plans cover less. And different companies in different states usually don't offer all these plans. They offer some of them. And that's something you can study. You can also work with our consultants who can help you navigate all this. Now, I want to talk about premium ranges because this is a very important thing to understand. This is just an example. This comes right off the government website. So you have Plan A is 93 to 351. Believe it or not, here's the same benefits, but radically different monthly premiums. Same thing for N and for G. And on top of that, whatever you're paying when you're 65, as you get older, there's a good chance those premiums are going to go up, partly because you're older and partly because everything goes up. So when you think about how much you're going to pay and what company to go to, you have to think more than just what's the initial benefit of the initial premium. Now here's a chart. These are the 2025 numbers. The 2026 weren't out yet. The takeaway from this chart, don't worry about the individual numbers, are that what company you go with makes a big difference in how much you pay at the beginning and how much you pay at the end. As an example here, Mutual of Omaha, Plan G, which is the most comprehensive plan, looks a little expensive here at the beginning, $164, whereas Blue Cross is $137, and AARP, which is United Healthcare, is $141. So you say, oh, gee whiz, I'll do Blue Cross because they're cheaper. Except by the time you're 70, Blue Cross is now more money than Mutual of Omaha. AARP is about the same. And by the time you're 75, AARP is the most expensive. Mutual of Omaha is the least expensive. So you got to think about what's going to happen as you get older and how much these rates are going to change as you get older. Because once you pick a plan after that first 6 months, it's pretty hard to change because you're subject to medical underwriting. So if you develop some chronic conditions, you may not be able to. So basically, you've got two choices. You can stay with original Medicare, Part A and B, get a Medigap policy, and get a Part D to cover your drugs. Or you can get a Medicare Advantage plan, which will cover A, B, and D, and you can go those two different ways. But there are some common things. In each case, you still have to pay the Part B premium, even regardless of what you do. You still have this caveat if you're lucky enough to have a lot of income when you're retired. Your Part B premium will go up significantly if you're making quite a bit of money. And again, that includes investment income, not just earned income. And then we have the differences. Again, these are all 50,000-foot views. There's going to be a lot more detail. If you stay with an original Medicare plus a Medigap, you can go to any doctor or hospital in the United States that accepts Medicare. There's usually no copays for hospital or doctor visits, but the monthly premiums are significantly higher than Advantage plans. If you pick an Advantage plan, most Advantage plans have a network of doctors and hospitals that stay in the network, although some of the newer plans are even being more lenient on maybe even going outside of the network. There's co-pays for hospital visits and therapy and other things. The premiums are almost always lower, significantly lower than Medigap. And again, they throw in some extra benefits. Let me just walk you through a quick example that happened to me. When I first got into eligible for Medicare, I had a Humana Advantage plan, and a year or two later, I had to have some surgery on my left shoulder. And so I went into the local hospital. I picked a shoulder specialist. Wasn't a problem. He was in the network. They did all the surgery, and basically, I think it cost me $250 out of pocket for everything. However, shoulder surgery, for any of those that have gone through it, requires a lot of rehab. There's a lot of physical therapy needed to recover from shoulder surgery. And I went to a local facility for rehab, and there was a copay of $35 a session. And I was doing physical therapy 3 times a week. So that was $105 a week for about 4 to 7 weeks to get my shoulder straightened out. Several years later, I had switched. Luckily, I was in good enough health that I could switch to a Medigap plan. And in that plan, I had to have a hip replaced. And so I went in again. I was able to pick a specialist who was an expert in hip replacement. Went into the hospital. They did the hip replacement, which is a fairly elaborate procedure. And I think the whole thing cost me $3 out of pocket. And there was some physical therapy after that, but that was all covered under the Medigap plan. So that's kind of an example of 2 different paths. One last thing, there's something you may hear about, an Accountable Care Organization, or ACOs. This is something I came up with last year, having to do with trying to get, if you have multiple doctors or multiple healthcare providers, get them to talk to each other and cooperate more to try to get things more efficient. You as a patient really don't have to worry about this too much. It really has nothing to do with you. It doesn't change any of your benefits. It's just something you may hear about. It just says that your doctors, especially your primary care doctor, is trying to coordinate with any other specialist you see so that they can, not have you take the same tests over again and share information so they can do a better job of providing you with a complete holistic medical service. Okay, this just came out 3 days ago. You can get this free. It's on the Medicare website. They'll mail it to you if you want. It's almost an inch thick, or you can download it as a PDF, and it's got all the details of almost everything you'd want to know. As a matter of fact, when you go in to the website for Medicare, you give them your email and sign up for an account. Every year they'll send you a reminder that says, "Hey, the new handbook is available. You want us to send it to you?" And they also send you notices and updates, keep you informed of all the latest things. Medicare has now come up with an app. I will admit that I haven't used the app, but my understanding is that one of the things that's nice about it is you can find out if a particular service is covered or not by typing in, "Is this covered?" And it'll give you all the information you need. You can it's a free one, of course. Download it from the App Store if you have an Apple phone, or Google Play if you have an Android, and give you some more information. Again, no cost. So let's go back over what I call Medicare gotchas. First one, as I mentioned at the beginning, is you want to give yourself a couple of months before you turn 65 to decide what kind of supplemental insurance you want and sign up, to give the government enough time to get all the paperwork processed, especially with what's been happening in the government. Their response time may be a little on the low side. The second thing is Medicare does not cover long-term care. It never has in the past, but there's some people that didn't appreciate that. So if you think you might need long-term care as you get older, you're going to want to look into long-term care insurance because Medicare does not cover that. One other thing, remember I said at the beginning, you get this postcard that says, do you want to turn down Part B? And I said, don't do that. And again, there's a few exceptions, but in general, if for some reason you say, well, gee, I don't want to pay that $206 and I don't want to get a Part D because I'm pretty healthy and I don't see a doctor very often and I don't take any drugs and I just don't want to pay that money. Well, if you don't, and then a year or two later you decide, gee, I think I better sign up for this because as I get older, I may have some health problems. If you delay, every month you delay, what you end up finally paying will be higher. In other words, that 206 isn't going to be 206. It's going to be more than that. And the longer you delay past 65, the higher that's going to go. And those penalties are forever. So with a few exceptions, you want to sign up at 65. And as I had mentioned before, if you're in a Medigap plan or you're in an Advantage plan and want to get into a Medigap plan and you want to change Medigap plans, you're subject to medical underwriting. If you're in an Advantage plan, you can change Advantage plans during the annual enrollment period without underwriting. Also, last item, some Medigap policies don't provide any coverage when you're out of the U.S. Some of them do. So if you plan to do a lot of traveling, you're going to want to look into that. There's also a small chance that your insurance premiums for your car may go up a little bit because when you go on Medicare, your auto policy becomes primary for medical and accident-related medical expenses. I didn't see that happening to me, but it was out there, so we thought we'd just include that and check with your insurance agent. Now, remember I said it's possible that you might be able to skip signing up for Part B. And there are three ways that you might not sign up for B. The first one is if your spouse is still working and their company is providing coverage that includes you, even after you turn 65, then you have what's called credible coverage from them, and then you can delay signing up for Part B and you won't have that penalty. If you are a veteran and you are getting all of your benefits through the VA, that covers you, and again, you won't have to pay that penalty if you ever have to go to Part B. And lastly, although I don't think this applies to too many of us, if you or your spouse are on Medicaid, you don't have to get Part B. Okay, here's a bunch of contact information. Again, this is all up on the website, our website, and you can see all of the government websites that you can go to. Encourage you to go to our website. It's got a lot of information. Okay, questions?
Mr. Gritt, you actually have to have Part B as a vet through the VA. Your situation is conditional and a very, very, very large one-off. But all other vets, even my mother-in-law who has TRICARE, is absolutely required to have Medicare Part B.
Okay, didn't know that.
It's Part D that you don't have to have, the drug plan.
Okay.
So Paul, can you
Yeah.
see the question? I mean,
Yeah,
they came in, so we'll cover them as due. Okay.
yeah. This one here is one that I'm not 100% up on. I would rather defer to our consultants.
That's going to be a financial question, not a Medicare question. I wouldn't feel comfortable answering that because Medicare is my expertise, not Social Security aspect of it.
So one thing Paul didn't mention is if you've got a complicated situation between two spouses or even in a divorce situation where you have an ex-spouse, you still possibly can get Social Security benefits from your ex-spouse. The way to figure that out is in these more involved situations is make an appointment with Social Security. You can do that on the website and make an appointment. There are numerous offices around Michigan and around the country, and actually go into the Social Security office, and they will go through your individual situation. One caveat with that is that if when you go into the Social Security office, they will only give you information about your own Social Security data. You need to go in with your spouse or ex-spouse or whatever in order for them to then open up. This is for confidentiality purposes. But so if you have this kind of situation, I would definitely recommend setting up an appointment, going in with all the people who are impacted by this, and talk to the Social Security analyst, and they will take you through all the details of your particular situation.
Another comment on that, though, is that you used to be able to delay, the spouse could delay, take half, and then at age 70, take the full Social Security. They closed that loophole.
That is true, and with all of these very funky rules that go in and out because of that, definitely going in and talking to someone, and now the website that they have, the Social Security website is more robust than it has been in the past. So some of this information about your particular situation, you might be able to get directly from the website, and setting up, and also there's you can set up an account on Social Security for yourself and then your spouse. So through the website and through your account on Social Security, you might be able to get this information, or as a fallback, actually going and talking to an analyst person to person.
Yeah, just this is Dave Key. The question you asked here about the taking half of the earnings. First thing, I think the advice of going to somebody in Social Security would be probably the best step for this. But the information I have is that if you file jointly your income tax, then you would not be able to just take half of your income, half of the income, to possibly get a lower IRMA. But I would say again that then I am not an accountant or CPA, and I would just have it'd be very advisable to get that verified. But from the information I have, that this would not be possible. But again, I'm not a CPA, so I would advise getting that, hearing it directly.
Make sure your Social Security records reflect that you're a U.S. citizen. I went through that with my wife, who was here on a green card for many, many, many years, and then got her U.S. citizenship about 20 years ago, and got a hold of Social Security, and they had to update some of her records. Yeah, I can believe that. Yeah, the corporate lease insurance, I don't think I'd worry about it. As I say, I didn't find it had any impact on my insurance, which was So that may be a caveat that isn't really significant. Okay, thank you all for your attention.